So, in today's video lecture, we are going to discuss pharynx. Pharynx is the superior expanded part of the alimentary system. It is a wide muscular tube. Here in this picture, the colored portion that you are seeing are the different parts of pharynx. The three parts of the pharynx are the nasopharynx, this yellow colored nasopharynx, this green colored oropharynx, and this blue colored laryngopharynx. As the name indicates, the nasopharynx is behind the nasal cavity, the oropharynx is behind the oral cavity, and the laryngopharynx is behind the larynx. The extent of pharynx is such that it initiates at the level of the cranial base and it extends till the C6 vertebra at the level of the cricoid cartilage. The posterior extent of the pharynx is the prevertebral layer of deep cervical fascia. As you all know that the deep cervical fascia has various layers. One of those is the prevertebral layer. So the posterior extent is the deep prevertebral layer of the deep cervical fascia. Anteriorly, as I've told you before, it communicates with the nasal cavity, the oral cavity, and the larynx. The narrowest part of the pharynx is the laryngopharynx. This lowermost part, the end of the pharynx, which is the laryngopharynx, is the narrowest part. Laterally, the pharynx communicates with the auditory tube. So anteriorly we have the nose, oral cavity and larynx. Posteriorly we have the prevertebral fascia and laterally we have the openings of the auditory tubes. The various parts of the pharynx I have already told you in the previous slides are the nasopharynx behind nose, oropharynx behind the oral cavity, and laryngopharynx behind the larynx. So first of all, we'll discuss the nasopharynx. Nasopharynx, of all the parts of the pharynx, as I told you in the first slide, that this is the initial part of the alimentary tract, the pharynx. But the nasopharynx specifically has a respiratory function. It is not involved in digestion or swallowing. It is involved in the respiration. So the posterior extent of the nasal cavities forms the start of the nasopharynx. In my previous lecture of nose, I told you the boundaries of the nasal cavity, the roof, the floor, and the lateral medial walls. Posterior extent of the nasal cavity was the posterior nasal aperture. So this is the start of the nasopharynx. The roof and the posterior walls of the nasal cavity continue backwards and they form the roof and posterior wall of the nasopharynx. So this part of sphenoid bone and this part of occipital bone, they are forming the roof of the nasopharynx. Inferiorly, the pharyngeal isthmus is a narrow part at the level of the soft palate. This level marks the lower extent of the nasopharynx. So at the initial boundary of nasopharynx is the posterior nasal aperture and the inferior boundary of the nasopharynx is the pharyngeal isthmus which lies between the soft palate anteriorly and the pharyngeal wall, posterior pharyngeal wall posteriorly. Laterally, I've told you before that there is an opening in the center that is for the auditory tube. Just above this opening is an elevation called the tubal elevation, which contains the tubal tonsil. And the tubal elevation extends down to form a fold called the salpingopharyngeal fold that is covering the salpingopharyngeus muscle. So here we can see that this elevation is the tubal elevation and it is overlying the tubal tonsil. And this elevation as it goes down, it is called the salpingopharyngeal fold which is covering the salpingopharyngeus muscle. In this picture, we can also see, again, we can see that this is the elevation called the tubal elevation. Inside this tubal elevation is the tubal tonsil and posteriorly this elevation extends down as the salpingopharyngeal fold and this fold is overlying the salpingopharyngeus muscle. Here again, this is the tubal elevation and this is the salpingopharyngeal fold. Now coming to the oropharynx, oropharynx has a digestive function. Superiorly, it extends from the soft palate. This part is the soft palate. So this yellow part we have discussed in the previous slides. This is the nasopharynx. Now we are going to discuss this green part, which is the oropharynx, and it is lying just behind the oral cavity. So the superior extent of oropharynx is the soft palate, and the inferior extent of the oropharynx is C3 vertebra, and which is also the point of epiglottis. So this epiglottis area, which lies at the C3 level, marks the inferior extent of oropharynx. So oropharynx is the part of pharynx that lies between soft palate above till the epiglottis below at the level of C3 vertebra. Posterior to the oropharynx are the three constrictors, which are the muscles of the pharynx. The circular muscles of the pharynx are the three constrictors. They are forming the posterior boundary of the oropharynx. And laterally, we have this tonsil called the palatine tonsil. This circle that you are seeing is the palatine tonsil. Anterior to the palatine tonsil is a fold that is called the palatoglossal arch, and posterior to this fold is this tonsil is a fold that is called the palatopharyngeal arch. So palatoglossal and palatopharyngeal arches are enclosing the palatine tonsil. Now we'll talk what is Valdeir's lymphatic ring. It is a ring that is formed by a specific arrangement of various tonsils in the area of the pharynx. So we have a single nasopharyngeal tonsil posteriorly and above, a single lingual tonsil that lies inferiorly. We have then a paired tubal tonsil on either side and a paired palatine tonsil behind on either sides. So the arrangement of these tonsils is such that it is in the form of a ring, and this is called Valdeir's lymphatic ring. Now we will discuss the laryngopharynx. Laryngopharynx is posterior to the pharynx, as I've told you before. The extent is starting from epiglottis till the inferior border of the cricoid cartilage, which lies at the level of C6. So from epiglottis till cricoid cartilage at the level of C6 is the extent of laryngopharynx. Anteriorly, it communicates with the uh, inlet of the larynx, and posteriorly we have the anteriorly we have the inlet of the larynx as well as the arytenoid cartilages. Posteriorly we have the C3 to C6 vertebrae. The oropharynx was till C3. After oropharynx is the laryngopharynx. Laryngopharynx starts from C3 and ends at C6. On the lateral side of the laryngopharynx, there is a fossa that is called the piriform fossa. This thin depression is the piriform fossa. It is bounded medially by the aryepiglottic fold and laterally by the thyroid cartilage and the thyroid membrane. So, between the thyroid cartilage and thyroid membrane and the aryepiglottic fold, there is a fossa called the piriform fossa. This fossa has a clinical significance as of any foreign body such as a fish bone can get lodged here because this is a very small restricted space. Now we'll discuss the muscles of the pharynx. There are six muscles of the pharynx. The three circular muscles, the constrictors, superior, middle, and inferior constrictors, and three longitudinal muscles that are the stylopharyngeus, the salpingopharyngeus, and the palatopharyngeus muscles. Superior constrictor muscle is this is the superior constrictor muscle at the top. Its origin is from, as you can see in this picture, its origin is from the medial pterygoid plate, the pterygoid humulus, the pterygomandibular raphe, and the part of mandible. This is the origin of the superior constrictor. Insertion of all constrictors is posteriorly on the pharyngeal raphe. So first of all, we'll discuss the origins of the three constrictors and eventually we'll discuss the insertion. So origin of superior constrictor is the medial pterygoid plate, the pterygoid humulus, the pterygomandibular raphe, and part of mandible. The middle constrictor arises from the greater and lesser cornu of the hyoid bone. This bone that you are seeing is the hyoid bone. So middle constrictor arises from the greater and lesser cornu of the hyoid bone. The inferior constrictor originates from the oblique line of the thyroid cartilage. The insertion of all three constrictors, the superior, middle, and inferior constrictors, is posteriorly on the pterygomandibular raphe. This line that you are seeing is the pterygomandibular raphe. This raphe starts from the pharyngeal tubercle on the occipital bone till the esophagus. So this line is the pterygomandibular raphe. The three constrictors start anteriorly and they come back in a circular fashion and they insert in this line that is called the pterygomandibular raphe. In this picture again, you can see all the muscles of the pharynx. The three constrictors that I've told you, and the longitudinal muscles are the palatopharyngeus coming from the palate, the salpingopharyngeus coming from the auditory tube, and the stylopharyngeus coming from the styloid process. Uh, all these, along with the three constrictors, are the muscles of the pharynx. This table very well explains the detailed anatomical structures that are the muscles of the pharynx. The three constrictors I have told you the origins and insertions. All three constrictors are supplied by the pharyngeal plexus. The cricopharyngeus is also a part of the inferior constrictor muscle. The stylopharyngeus is an exception. It is supplied by the glossopharyngeal nerve. The salpingopharyngeus and palatopharyngeus are also supplied by the pharyngeal plexus. So all the muscles of pharynx are supplied by the pharyngeal plexus except for the stylopharyngeus, which is supplied by the glossopharyngeal nerve. Here you can again see the pterygomandibular raphe, which is the common insertion of all constrictors. And these are the constrictors, the superior constrictor, the middle constrictor, and the inferior constrictors. The inferior constrictors are the largest of the three constrictors. Now I'll tell you what is Killen's dehiscence. The inferior constrictor muscle has two parts. One is the thyropharyngeus and the other is the cricopharyngeus. Here you can see this is the thyropharyngeus part of inferior constrictor and this is the cricopharyngeus part of the inferior constrictor. These two muscles have slightly different function. The thyropharyngeus has propulsive action and the cricopharyngeus muscle has sphincteric action. So when the food is coming down, the thyropharyngeus propels the food downwards. And this cricopharyngeus acts as a sphincter and it opens and allows the food to pass through it. But if there is some pathology, this cricopharyngeus does not relax and the food accumulates in this area. So this area is already weakened as the superior constrictor is not overlapping this superior and middle constrictors are not overlapping this part and this is weakened. So the the area between the thyropharyngeus and the cricopharyngeus diverticulates outwards because of the accumulation of food. Here you can see this is thyropharyngeus part of the inferior constrictor and this is the cricopharyngeus part of the inferior constrictor. As you can see, a lot for, direction of the fibers is also such that this is for propulsion of the food and this is for the sphincteric action. Now, the nerve supply of all the muscles of the pharynx is the pharyngeal plexus. And the pharyngeal plexus is formed by the vagus nerve, the glossopharyngeal nerve, and the superior cervical sympathetic ganglion. The motor fibers to all muscles are through the pharyngeal plexus, mainly through the vagus nerve, except for the stylopharyngeus, which is supplied by the glossopharyngeal nerve, and the inferior constrictor has dual supply as it has two parts. So it has the external and recurrent laryngeal nerves of the vagus nerve supplying it. The sensory innervation of the pharynx is through the glossopharyngeal nerve mostly, but partly through the vagus nerve. The nasopharynx is supplied by the maxillary nerve through pterygopalatine ganglion. The blood supply of pharynx is the pharyngeal branches of the external carotid artery, the palatine and tonsillar branches of the facial artery, the lingual branches of the lingual artery, the greater palatine pharyngeal and pterygoid branches of the maxillary artery, and the veins of the pharynx drain into internal jugular veins and the facial veins. The lymphatic drainage of the pharynx is to the retropharyngeal lymph nodes as well as the deep cervical lymph nodes. This is a very important table. It briefly describes everything that I've told you in this lecture. It has the situation, extent, communication, nerve supply, relations, as well as lining epithelium and function of the three parts of the pharynx that are the nasopharynx, oropharynx, and the laryngopharynx. That's all for today. If you have any queries, please ask me in the comment section and I'll reply.